and her background includes working at various public, private, and nonprofit entities, also an avid bird watcher who's traveled worldwide to learn about birds and ecosystems and people. So this is a panel entitled Challenges to Human Health and Quality of Life. Thank you.
Good afternoon, everyone, and welcome back. Having a healthy and well population is integral to Idaho's economy. And for me, one of the highlights of being involved in this summit was having the opportunity to reach out to a number of other professionals, not just health professionals, but people working on different cultural and recreational issues throughout the state of Idaho and even beyond Idaho, to really learn what conversations were happening in these different realms and what they were doing in their work related to a changing climate. So I'm really happy to be able to introduce to you this afternoon some of the people that I met, and I'm excited to be working with not just today, but into the future on some of the issues that they will be talking to you more about. We will have 3 presenters in our panel this afternoon. The first presenter will be Ms. Allison Crimmins, who was the lead author and lead coordinator of the U.S. Global Change Research Program's assessment on climate change and human health. She is an environmental scientist in the EPA's Office of Air and Radiation Climate Change Division, and she specializes in climate change risks and impacts. So Allison is going to be with us today sharing some of the key findings from that report on climate impacts on human health.
Okay, great, thank you. And thank you for having me, and hopefully everyone got some coffee. No one's gonna fall asleep after lunch. We're gonna talk a little bit about the findings of this report, and before I get into the findings, I just had one slide that I wanted to put up here, not just to impress you with my use of acronyms, but to give you a little bit of background about the report itself. So this is a product of the U.S. Global Change Research Program, or USGCRP, which is a federation of 13 federal agencies that work on global change issues. And this was formed in 1990 under the Bush administration. It's congressionally mandated that this group look at the impacts of climate change and assess those impacts on the U.S. And so every 4 years or so, they put out a big national climate assessment. But basically you get this huge 800-page report, and then you don't hear about them for four-ish years again. And so one of the things that we wanted to do was pick a topic that's covered in the National Climate Assessment and really dig much deeper into it and kind of expand it into a whole report on its own. And so this is the first time we did that, and we chose the subject of health because this was identified as a really important topic. And so back in 2013, we started envisioning this report. We pulled together a team of authors from 8 different federal agencies who all worked together to pull this report, put this report together. And that right there is a success, I think, to get 8 agencies working together on anything. But it also gave us this really great perspective from lots of different parts of the government who all could come together to talk about the impacts of climate change on health. And we did most of the writing of that report in 2014, and then 2015 was multiple rounds of reviews and revisions, including opportunities for public input, public comment, a National Academies of Sciences peer review, interagency reviews, lots of rounds of revisions until we finally came out last year with this final document. And so I'm going to be talking about the findings of this report. And I'll walk through these 4 main findings. And so the first one here, it's a good one to ease you into it after lunch. It sounds pretty simple, that climate change is a significant threat to the health of the American people. And I mean, this is kind of an obvious statement, but it's one that actually needs to be made very, very clearly. And there's a couple key elements in this sentence. First, it says climate change is a significant threat. It's not climate change will be a significant threat. This is something that's happening right now. The other part of this sentence that's important, I think, is the fact that we're talking about the American losing their homes or their lifestyles. So an example of where climate change creates a new public health threat, I don't mean new as in a brand new disease you've never heard of before. I mean new as in a public health threat that's existing in a new time or a new place. So here's another air quality impact that I'll talk about. It's the impact of climate change on air allergens. And so climate change affects pollen is produced. It can affect how allergenic that pollen is, and it can also change the length of the pollen season. So this is a figure showing observed changes, not in the future, happening right now, observed changes of the ragweed pollen season length. And you can see we did this transect, north-south transect. And as you move north, the length of the ragweed pollen season is extended. And in some places as much as a month longer than it used to be just in the 90s. And so this has, of course, a lot of health impacts for people who suffer from hay fever. The third message of this report, I get asked a lot, so, what's the big findings? How did you advance the science with this report? And I'm gonna give you a range of examples where we have better quantify the impacts of health. And what I mean by that is, quantifying the number of cases, the number of people getting sick, the number of people dying. I'm going to give you some examples of where we may not have that quantification, but where we've improved our ability to discuss the links between climate change and change in exposure and change in health outcome. And then I'm going to end with a couple examples that are pretty well studied, but not very well known. So I'm going to flip through a range of examples fairly quickly and give you sort of this broad national scale before Steve gives you a more local scale. So the first one I'm going to talk about is temperature-related death and illness. We looked at both heat and cold impacts. And this figure shows you two different models that are looking at the increase in heat-related deaths in red and the decrease in cold-related deaths in blue. And you can see that the increase in heat-related deaths outweighs the decrease in cold-related deaths that we project into the future, such that we're expecting thousands to tens of thousands of premature heat-related deaths each year by the end of the century. Another interesting point from this chapter was actually that even fairly small changes in temperature can have a big impact on mortality and morbidity because they happen so much more frequently. Our third chapter was on air quality. I already talked a little bit about aeroallergens and wildfire, so I'll talk about ozone in this one. Climate change and warmer temperatures make for more conducive conditions for ozone to form, and this is not ozone like ozone layer ozone, this is ground level ozone, so smog. This is some maps showing the change in temperature leading to change in 8-hour ozone concentrations and the associated change in deaths associated with that increase in ozone. And this has a lot of implications, not just mortality, but lost productivity, lost work days, lost school days, hospital or emergency room visits associated with these kinds of air quality emergencies. Our fourth chapter looked at extreme weather events, and we looked at a range of events including wildfire, drought, extreme precipitation, flooding, winter storms. I think a really interesting outcome of this chapter was that we found a lot of impacts from extreme weather events, not just when the event was occurring, which I think is what people tend to think of, but impacts that occurred before the event while people were preparing, and impacts that can occur long after the event, and even far away from where the event happened, as you see these sort of cascading impacts. Chapter 5 is on vector-borne diseases, and Heather mentioned this this morning as well. Our chapter looked at both ticks and mosquitoes, and used the cases of Lyme and West Nile virus. And you can see that just in these couple of years, we're seeing a change in the distribution of West Nile virus cases. This is just the neuroinvasive disease, which is about 1% of West Nile cases, but it's the cases where you almost certainly go to a hospital, and so these are the ones that get recorded. With climate change, we are going to see a change in the life cycle of mosquitoes, the habitat of where these mosquitoes can thrive, but also how fast the virus virus reproduces within the mosquito's body. And so you're actually going to see a pretty big change in the distribution and patterns and behavior of these types of mosquitoes that not just carry West Nile virus, but also diseases like chikungunya, dengue. All right, chapter 6 was our water-related illness. We talked a little bit about water quality this morning as well. This is a great example of one of those places where climate change is creating new public health threats, because we expect to see waterborne illnesses happening in different times of the year, but also in different bodies of water where that hasn't been an issue in the past. So this is an example of a harmful algal bloom in the Puget Sound. And if you can squint at these little dots, maybe look at the month of April. And if you look at the black dot that shows you the baseline, now walk over to February and you can see that in the future, the levels that we expect now in the future will be happening 2 months earlier. And so this is an example of where we're seeing threats in new times. Chapter 7 was on food safety, nutrition, and distribution, and we talked about the impacts of climate change on pathogens and the multiplication of Salmonella and E. coli on food. You heard from Juliet this morning too about the impact of temperatures on fungal growth and mycotoxins and aflatoxins. I wanted to highlight one finding from this study that I think is a good example of one of those really well-studied but not very well-known impacts, and that is the impact of rising CO2 on the nutrition of your food, and specifically the protein to carbohydrate ratio within especially C3 crops. So with rising CO2 concentrations, we actually see a decrease in the protein to carbohydrate ratio. We also see a decrease in a number of micronutrients. So very literally, the piece of bread you're eating right now is more nutritious than the piece of bread that someone will be eating in 2050 and 2090. Or if you're old enough to remember those old cereal commercials, you have to eat 7 bowls of whatever Raisin Bran to equal the nutritional content of whatever cereal they're selling. So this is something that's actually really well studied globally and something we don't think about, but it has a lot of implications in countries where there are already protein deficiencies, but also in places where where obesity is an issue, as we're seeing that change in protein carbohydrate ratio. And chapter 8 was on mental health. I was really happy that this topic was a subject all to itself, got its own chapter, because it very easily could have been folded into every single chapter that came before it. So all of the impacts that I just talked about, that I just breezed through, all of those have mental health impacts. And especially if there's an extreme weather event that causes a loss of life, a loss of property, loss of livelihood. I think there's also a lot of mental health impacts from just hearing about climate change so often, from seeing it on the news, from having these events happen more and more frequently. I pulled out key finding 4 here just because I thought that's another one that's maybe a little lesser known, that people with pre-existing mental health issues are often taking medication that makes it more difficult for their bodies to thermoregulate, so regulate their own body temperature, which means those people can also be more at risk from extreme heat events. So the last message of this report, and the one that I'll end on, is that every American is vulnerable to the health impacts associated with climate change. And while that's true, while every American is vulnerable, there are populations that are disproportionately affected. And so this was a subject that we heard a lot of feedback on. This is the longest chapter, the most authors, the most public comments, the most revisions. People really wanted to make sure we covered this topic really well. And so it's discussed throughout the chapters, but also in a standalone chapter where we dive into these 7 different populations and look at how these groups are disproportionately affected, either because they are more exposed, because they are biologically more sensitive, or because they have less ability to adapt. So to circle that back to the key point that every American is vulnerable, I want you to take a look at this list and think about the impacts I just talked about and this list here, and see yourself in there. I mean, we were all children at one point. We all hope to be older adults. We've seen impacts on the East Coast, the West Coast. We see extreme heat in the North. We see coastal impacts, inland flooding, tribal groups, people working outdoors, pregnant women, people with pre-existing health conditions or disabilities. And I've pretty much just named everybody in the United States, or at least someone you know. So again, this gets back to that first point I was making, that this is not a faraway threat that's happening to somewhere else far off into the future. This is impacts that are happening right here to us, to the people in this room right now. So before I leave you, I just wanted to put out a little plug for the next National Climate Assessment, the 4th National Climate Assessment. 2 weeks ago, the final volume 1 of the 4th National Climate Assessment was released, and the draft volume 2 was released. So it came out in 2 versions, or 2 volumes. The first volume was kind of the more wonky climate science, temperature, precipitation, ice, paleoclimatology type background. But that second volume, the National Climate Assessment, is on impacts, and it is open for public comment right now through the end of January. And I would urge you to make sure that your issue, your research, your people, your voice is in this document. There's a chapter on health. There's a chapter on tribal issues. There's individual chapters by region on the Pacific Northwest or Northern Plains. And so please take a look at it and comment on it. This is your opportunity to make it your report. Even if it's written in wonky scientific language and you'd prefer it was written in English, you can tell us that. So we look forward to your feedback to improve this document. I'll leave you with that. Thanks.
Thanks, Allison, for kind of providing that overarching perspective for us about what a changing climate does mean for health. And our second presenter is going to use that as a jumping off point to talk about what we know about some of the impacts we are seeing and will continue to see, specifically here in Idaho, about the ways that changes in our climate do impact human health. So I'd like to welcome Steve Pugh. Steve is the Director of Environmental Health at Southeast Idaho District Health Department in Pocatello, and he will be talking about Idaho-specific impacts.
Thank you, and it's great to see this many people. Thinking back a few years ago, I went to a conference sponsored by the University of Washington. It was a tri-state conference with Washington, Oregon, and Idaho. And there's all these people there, and there was 3 of us from Idaho. and one of them's retired, and the other two of us are looking at retirement very closely. So it's good to see this many people interested in Idaho finally getting into looking at climate change. It's something that's needed to be done for a long time. I'm going to talk about climate change and health in Idaho, and really look at it as an overview from the public health district standpoint. Realize in Idaho there are 7 public health districts. We're all governed by a board of health, and we're all a little bit unique. We can do all of the same stuff, but we can respond regionally to things that we need to respond to. And so that's really what I'm going to be hitting on. The other thing that's on this slide that I really want to point out is that I have a colleague that went to a meeting, and he was very interested in climate change, and he mentioned the word climate change in the meeting. And he was about to get drug out of the meeting. They were ready to string him up. So we had to find some way that we could talk to people and get them to listen about the issues and planning for public health related issues. And we in Southeastern Idaho Public Health have started using the term extreme weather. It's easy for us to point to extreme weather events, and we've got a lot of snow, we're going to get flooding, or we don't have any snow, we're going to have severe drought. It's easy for people to get a handle on that. If we talk climate change, sometimes that's a little more difficult for them to get a handle on. And so that's the terminology we've chosen to go with. Some people don't like it, but I think it's okay because at least it gets conversation going amongst groups of people. So when I was first asked to do this, I know as the district health department, we don't have a lot of data on public health data associated with climate change. So I contacted Colby Adams, who's the environmental health director at the State Division of Health, figuring he would have the information. Quickly was told, no, there is no information. Idaho is one of 2 states that does not require hospital discharge data to be submitted to the state. So it's very hard to track what goes on. Because of that, we also cannot participate with the CDC's Environmental Health Public Tracking Program, which looks at health surveillance and environmental health monitoring data across states. We have no way to get that data. So it's very hard for me to say that with a wildfire, we're seeing this many asthma, respiratory, or COPD effects. It's something we really can't say because it just doesn't exist. We will have some syndromic surveillance capability coming soon, but realize it's only for emergency department data. Doesn't include general hospital data, doesn't include physicians' immediate cares or any of those sort of things. So it's somewhat limited. Typically, it's not environmental health data. It's typically infectious disease. But in talking to our epidemiologists, we can query for some environmental health factors and see what's going on in the community. We are at Southeastern Idaho Public Health starting to work with Oregon and Washington to possibly use their data and extrapolate data that they collect, since they do get hospital discharge data, to climate and ecosystem that's very similar to what we have in the Pocatello area. We're just at the beginning stages of that, and I'll talk a little bit more about that here in a few minutes. So the next question is, where's the money? Being a government agency, we have to have money to do various programs. Climate change, there is no money available for us to do any activities. I have in my budget a very small line item I call disaster preparedness, and my boss is more than willing to let me work in the program. And that's where I'm able to do the work that I can do. But in some health districts, they don't have that ability to do it. Also realize that our staffing has been scaled back dramatically since 2008 when we had the downturn in the economy. I went from having a staff of 12 and now I'm down to 8. Yet we still have the same workload that we did before. And so it really stretches my staff. It makes it difficult for us to do a lot of work, but I'm more than willing to put the effort in to do it however I can do it. But I think public health should be at the table to do these sort of things. There was some limited funding. We have a public health preparedness program, and there was some limited funding there. But I understand this funding cycle, that funding has been taken out to look at climate change. So again, it's just what we can do with the time that we have. So in Southeastern Idaho Public Health, one of the things that we did, I worked very closely with our public health preparedness manager. We established an extreme weather working group. And we reached out to a lot of different agencies. We did have individuals from Idaho State, Department of Environmental Quality, other public health individuals. And we sat down to look at what are the issues, what are the public health issues that we have in the area, and what can we do to mitigate or deal with those issues. It's very hard to keep that committee going. It wasn't really sustainable. Again, there's not money. Everybody has a job to do. But I think one of the things that came out that was really good is that we were able to do a hazard analysis and look at what are the top 3 things that we want to focus on as a group or as Southeastern Idaho Public Health or other public health agencies that are affecting us locally. The 3 we came up with, we've talked a lot about wildfire today. Again, long seasons, tend to be more severe. We have a lot of health effects associated with them. Water supply is one that came up in our area. The city of Pocatello is on its own aquifer on a portion of the Snake Plain aquifer. City of Pocatello has been mining that aquifer for a number of years. We've got an area where groundwater is exposed. It hasn't had water in what we call the highway pond for as long as I can remember. And this year, after the big winter, we finally had some water in it, but we still are mining that resource. And so we've got to know how to deal with that and how we're going to deal with it with future growth as it comes. And lastly, flooding. Again, we've seen flooding statewide. And it has an impact on us a number of different ways, and I'll talk a little more about that in the future in a bit as well. So what are we currently doing? At Southeastern Idaho Public Health, we were actually lucky enough to get a CDC Public Health Associate. She's going to be with us for 2 years. She does a number of different things, but her primary focus is going to be on climate change and looking at issues, especially starting with wildfires and asthma. As I mentioned, trying to look at Oregon and Washington data and correlate that back to what it might mean for us. And then she'll be able to make recommendations to our Board of Health on how maybe we can mitigate or deal with those issues. So as you see, a lot of my theme here is planning. We're trying to plan for these events and be prepared for when they happen. And that's really what we're trying to do. We also had an ISU graduate student just do some literature review of 2 impacts in the local area. And the 2 he chose were vector-borne disease, specifically looking at Rocky Mountain spotted fever and wildland fire. It was interesting, his conclusion on Rocky Mountain spotted fever was that it would probably decrease as temperature increased because the tick activity would be much narrower. Of course, being an entomologist, then my question is, what's going to replace that? Because something's going to come in and feed on us or pass a disease along. So might be some good, but there's always something else behind it. Lastly, we're working with Idaho State University, the Masters of Public Health partnership with Dr. Four. Their class is putting together a list of climate change issues and public health. They will then be presenting those recommendations to us and to our CDC associate, and we will then decide which items we want to work on locally, again, to be prepared, what we think might be big events that we need to be prepared for at our level. I put SIF response on this, but really this is statewide response. We've seen flooding statewide. Especially last year, we had at 97, 2011, we had a lot of flooding last year. There are a lot of impacts from this. A lot of private wells are impacted by flooding, and they may end up getting bacterial contamination, there may be chemical contamination from the floodwaters. There's a lot of issues that come with those. In addition, septic systems, people don't think about it, but a lot of times they get washed out. And the last thing we want is open sewage. And so we're really dealing with trying to educate those people. And lastly, mold. People don't think about mold, but as it gets in their house, it's a big issue, and it does cause some respiratory distress. And so our charge when it comes to flooding is really try to get the word out ahead of time of things we can do or things people can do to help mitigate those effects of the flood. And then after the flood, we certainly go around and help people all we can. But again, we're limited resource, limited staffing to do a lot of that information. Drought has really hit us significantly. I think that's been touched on this morning. We have had a lot of wells that have had to go deeper. I had my public water person make a comment to me a couple years ago that as the drought continued, he was seeing more and more contaminated wells, more and more contaminated water systems. Now, I don't have numbers to back that up, but that was his feeling, and he'd been in the program a long time, so I really did trust him. So it's interesting to see what effects drought can have on water quality, whether it's bacterial or chemical, as it goes on. Smoke, we talked about smoke quite a bit today and its effects, respiratory and asthma. And as district health departments, all environmental health directors participate on a weekly smoke call that's initiated by the Department of Environmental Quality. And they have weather patterns and a lot of other people on there, and we try to pass along information to the public about where we may see smoke events or where smoke may be hazardous to the health or something along those lines. Lastly, a little bit was mentioned about harmful algal blooms or algal blooms in general. This is another issue we're seeing statewide and more frequently than we've ever seen in the past. And a lot of environmental health directors have noted that in my discussions with them. Again, we participate with DEQ, limited funding to do sampling, but we really rely on the public. We try to do education and outreach and get the information to the public and get the complaints from them. And then we work with the people who manage the water body, whether it's Bureau of Reclamation or a canal company, if there are algal blooms, to try to post those waters, because so many people come from out of state. They don't see it on the media, but if we can post those waters, we're further ahead, at least to getting notification of people to avoid contact with them. And lastly, emerging issues. West Nile virus kind of caught us a few years ago. We knew it was coming, but it came fast. We had to deal with it. What's the next emergent or infectious disease that's going to come? I'm waiting. I wish I had a crystal ball and could say I knew what it is, but I don't. Degradation of air quality is another issue. Smoke, wildfires, and as I mentioned, if we get flooding, we get mold issues that people need to deal with. Thermal stress, hot and cold. We don't have it's not as bad as in Seattle where they don't have air conditioning. If they get a real hot event, a lot of people are really impacted, but we do have hot and cold times, and people who can't necessarily afford air conditioning or heat their house, how do we deal with those, or how do we provide cooling or heating centers or help those people adapt to those situations? We have extreme weather events. I've seen more flooding and dust storms in the past few years than I've ever seen. We've actually had the freeway closed because of dust storms. It's just intense. If you can guess, the wind never blows in eastern Idaho. And lastly, the psychological impacts. And this is interesting, and I'm glad you mentioned it earlier. People really get spun up over issues, and sometimes they can just be perceived issues. And I think we spend more time dealing with the word well than we do dealing with the people who are actually impacted. As an example, we had last year an incident where somebody knew that we had kissing bugs in southeast Idaho. Well, we don't. We have leaf-footed bugs. They look very similar, but they're not the same, totally different. And the amount, just going on social media, the amount of angst and concern and it was unbelievable what the community was doing and saying. And it took us a lot of time just to deal with those issues. And again, it's not a public health issue, really. It wasn't an organism that was of concern. So they can really get themselves spun up. I think I want to just end with that most public health officials really believe that extreme weather events will move more and more infections northwards, or potential infections northwards, and I agree with that. And so in conclusion, I really believe public health should be at the table. If you're setting policy, developing rules, anything along that line, health is impacted by these. And this slide's from Harvard School of Public Health, and it just kind of summarizes that really for every effect, there's usually a health effect as well. So again, we'd love to be at the table, and we're love to be prepared for these events as they happen. So thank you.
Thanks, Steve. And this is my reminder that you have some blue 3x5 cards on your tables in front of you. So if you'll be jotting down some questions as you go, we are anticipating having time for those at the end of the session, and kind of wave those in the air, and one of our planning committee members will take those off your hands for you. Our third speaker as part of this panel you met earlier this morning, Josiah Pinkham, is from the Nez Perce Tribe's Cultural Resources and Climate Change Task Force. and he is going to talk with us a little bit today about the cultural ramifications of a changing climate and the impact on traditional practices, way of life, and well-being.
Thank you, everyone. I apologize, I don't have a PowerPoint presentation, but I do have backup answers that will be coming in. I've spent quite a bit of time kind of contemplating this dilemma that humanity is in, and I've visited with my elders and sat listening to some of their stories, and I think that one of the biggest dilemmas that humanity faces in just this overall survival equation is twofold, and it's awareness of and action on the need for a sensitive relationship with the environment. Now, that's a really heavy thing to contemplate in this contemporary lifestyle, because we're inundated with things like cell phones and internet. I mean, you know, never before have we had the amount of information and data that's available to a human mind, but yet never before have we been so starved for connection. And I think that's the thing that I rely upon in terms of when I turn to my traditional teachings, my rituals, ceremonies. That's what that stuff does for me, is it restores that connection that that I grow separate from as I come into adulthood. So that song that I sung this morning, that basically comes from, you know, this divine place that's given to me as a Nez Perce. When I walk this land, that type of a song comes out before I even go and pick a huckleberry. And it's because it reminds me of my connection to that huckleberry, how that huckleberry sustains me as an individual. And so I also have to think about what that huckleberry relies upon. And so with that comes this awareness of huckleberries, the plant, the earth, oxygen, water, all of these different things that sustain me. And so I realize that I'm not alone here. And that's a big difference between how a Nez Perce is raised in their traditional homelands and how an American thinks about the landscape. So now Americans face a very unique dilemma, because Americans come in, they colonialize this place based upon a nominal language. Now, a nominal speaker, a person that speaks a nominal language like the Romance languages, they come into a void, they pull things out, they label it, they categorize it for manipulation. A Nez Perce speaker, you cannot master Nez Perce language until you master 5 different verb tenses: present, past, future, distant past, distant future. So those spatial relationships across time and space, they're explained differently. They're written into that language differently. So you realize that there's this immense amount of time that comes before you and this immense amount of time that comes after you. And so you have a different understanding of how important history and future are connected. So now I can rely upon my oral traditions and tell you about a place called Ipnauyataspa, which means, it translates into English as the place where ice moves on its own volition. And an elder took me out to Lick Creek and said, that's what this place is called. And it was a valley that was hollowed out like that. And it was a place where there was a glacial movement thousands of years ago. And the Nez Perce still retain the name for that place. So that history goes back thousands of years. But that also puts a responsibility on me to look forward to my future and ensure that that continues on. That's the responsibility that is placed upon me as a Nez Perce in my homeland. And so I rely upon those things to basically keep me connected to all these different things. So my sense of community is vastly different from the typical American, because it includes salmon, it includes huckleberries. It's not just limited to people. It includes animal people that walked this earth before the Nez Perces even got here. So with that sense of past, what does that do for my future? I have to be tremendously foresighted and think about things like environment, land, trees, salmon. And so my challenge today is, how am I to basically keep that going? And what does that mean for you all? So the thing that I want you to contemplate is, how are we going to empower, how are we going to acknowledge the inherent power of our indigenous scientists? Because our indigenous scientists carry all of that stuff right here. So when they walk this land in their homeland, wherever that might be, they have a different sense of community. They have a different sense of connectivity. They have a different sense of responsibility. And they're trying to give back in a different way. We need that diversity at the table where these important decisions are being made. So these indigenous scientists are coming to the table with different perceptions, but they're also coming with different questions. They're coming with different observations of the challenges that we face for our children. So things like ASIS, the American Indian Science and Engineering Society, these are powerful movements where indigenous scientists are basically being acknowledged for that diversity that's necessary at the table. And I think before I get too far carried along, I just want to thank you all for being a part of this, this event. I really appreciate the diversity of not just minds and disciplines, but the organizations from universities to private entities to tribes, everybody getting involved in this important work, because this is one of the biggest dilemmas that humanity faces in this overall survival challenge. Thank you.
Thank you, Josiah. It's an honor and a privilege to work for the Nez Perce people on climate adaptation, and for all Idahoans. I think Josiah did a really good job of kind of bringing it here, and that's why we're doing what we're doing. And I think it's good to connect our day-to-day lives with the facts, the statistics, the science. And so we have some really good questions. The first question is, are there extreme weather working groups in other parts of Idaho? I think Steve might be a good.
That's a really good question. I know we have one in Southeast Idaho. I believe there's been some attempts in Northern Idaho, but I'm just not aware of that many working groups right at this time. I would certainly hope there would be soon, but not yet.
Okay. I can tell you that the tribe is thinking about extreme weather in our all hazards mitigation planning. Just as one example. So the next question, is there an important public health consequence of not exercising outdoors because of smoke? Running, cycling, hiking, and swimming. I think Allison and Josiah might be good people to answer this question.
Well, I think we heard this morning a good example of that. I'm sorry, I've forgotten the gentleman's name, but he was talking about riding his bike to class during a time of wildfire smoke and bad air quality. And, one of the adaptive measures that we can take with these increases in extreme weather events is to not go outside and shut our doors and shut our windows and crank the air conditioning on. And if you listen to what Josiah was saying, that's a terrible outcome. That's a terrible adaptation measure. There's so many health benefits of outdoor activities and riding your bike. So I hope that's one that we can avoid.
Josiah is an engineer and a scientist.
The only thing I can add to that is that there's consequences to everything. I mean, you know, just keep moving, stay outdoors as much as you can, seek guidance. I would say just get out there and move around. I mean, we spend way too much time indoors. Unless you have a very significant health consideration, get out there.
This question is for Allison. If increased carbon dioxide in the atmosphere is decreasing nutrient quality of foods, wouldn't logic follow that carbon sequestration via regenerative agriculture would have a similar effect?
So rising CO2 does have a fertilization effect on plants. It does, to a certain point, increase plant growth. Unfortunately, a lot of what we're seeing, though, is that the CO2 increases, maybe the plants get bigger, but it's not necessarily the part that we care about, which is the food. So we do see a potential increase in yield up to a point from CO2 fertilization. Of course, when you have wildfires and extreme weather events and extreme temperature also acting at the same time as rising CO2, that tends to give you a little bit of a mixed bag. And after a certain threshold year, you get past the point where that benefit of CO2 to agriculture wins out.
Thank you. This is for Josiah. Given the separation of our cultures, can you envision real and practical ways for more interaction between Euro-Americans and Indigenous people? We need your culture and wisdom.
It's a little bit of a black and white question. Simple answer, yes. I should probably add to that, though. I am tremendously reassured by collaborative efforts to involve tribal voice at the table at varying levels all the way up to presidential administrations. It's very, very important to have the tribal voice at the table because of the reasons that I expressed earlier in my talk. Without them, America faces the dilemma of driving a car without touching the wheel. I mean, there's guidance there that is absolutely necessary. Now, one thing that I failed to mention in my talk earlier was this point that was put across to me by a book called Vanishing Voices. Vanishing Voices had one key point in there where it talked about the plight of indigenous languages worldwide. We lose every 2 weeks, we lose an indigenous language. Now, those indigenous languages are expressions of relationships, just like English is. You express a relationship with your environment in a particular way. Those languages, when they perish, the biodiversity isn't far behind. Everybody depends on biodiversity. America does, our economy does, Fortune 500 companies, Idaho. I mean, who doesn't, right? So it's really important to involve those tribal voices at the table because you bring a diverse set of inquiries to a particular challenge. So yes, I can definitely envision that.
Thank you. So in closing, I just want to, this is the last panel before we move to the human-centered design workshops. And I just want to talk a little bit about how human health and quality of life is near and dear to my heart as a person who loves nature. And I think this summit and this panel has provided a good opportunity to think about the why. Why do we want a strong economy, a stable climate, and a healthy planet? This is also a good time to center ourselves on our hearts and reflect upon what makes our lives meaningful. Connection, celebration, recreation, creation, community, inspiration, spiritual and personal growth, family, friends, and of course, falling in and being in love. That's what we live for. If you look at our advertising that businesses put out to try and sell things to us, you realize that it's clear that people absolutely love nature and beauty. That the time that we spend outdoors is precious to us. That our fondest family memories are times in nature with friends and family. But sometimes we forget that we are nature. We depend upon it. We are a part of it, and our well-being is intimately tied to it. The people, wild places, species, and experiences that we love make our lives meaningful, and for many, including me, provide the motivation to act. I hope that this panel has helped us all to focus on the why, as we prepare to talk about the how. Please join me in thanking our incredible presenters for their work, their devotion, and for sharing with us today.
Thank you, everyone. Thank you. I thought that was a lovely coda by Stefanie. And true, our next will be the breakout sessions, and I'm going to introduce Amber Beeg. She's a partner with Warm Springs Consulting, and she works with communities on resilient strategies, mission-driven businesses, on sustainable growth, and supports entrepreneurs in birthing their visions. You know, for nearly 2 decades, she's led visionary projects, raised millions of dollars, and engaged communities to support innovative ideas on campaigns for both government, mission-driven companies, and NGOs. Please join me in welcoming Amber Beeg.
Hi, everyone. Thank you. First of all, I'm wowed by the panelists today. It beyond exceeds what we dreamed, so it's really exciting. And the next phase is actually listening to you, because that's why we're here. That's why we have the format of this conference, is because we believe that all of you have something important to share. And we're all in this together. And so that's why we're asking everyone to participate in this conversation, because obviously we haven't solved this. So we're asking everyone to come together and solve it in a collaborative framework. So this is exciting, because we have more than 50 facilitators who have been trained around the state to lead these small group discussions. And these small group discussions use a framework called human-centered design. And human-centered design is a design thinking framework that engages empathy, uses creativity, and eventually solves problems. And I've seen this framework used with large organizations. A lot of governments have been starting to use this framework because they realize there's something really, really important about that engagement, about listening to each other, about reaching across the table and finding common ground. Because when we do that, we actually work in a solution space rather than a combative fighting space. So our workshops will begin with panelists, and the panelists will share some of their experiences in their particular sectors. So they're topical experts. And then we will group, that'll be about a half an hour, and it'll be an informal discussion. So less formal than this. The small groups will talk about their experiences, and then we'll move into the small group facilitated sessions. So the panelists and the facilitators have been trained. All of them have done extensive training with us, and they also have this 18-page guide. We ran into a hiccup where there's a stomach flu going around, so we have a shortage of facilitators. So if you find that your table you've been assigned to does not have a facilitator, I will come around and make sure that everybody has a facilitator. There might be 2 tables per 1 facilitator, but actually it's designed to accommodate that. There should be no problem. Up to 20 people can work with 1 facilitator. So the topic assignments, how we came up with the topic assignments, when you registered, you filled out your preference for the topics. And we did our best to group you. into those topics, but we also have space limitations. So if you are not happy with how we assigned you, feel free to move, but please, if you can do your best, find a room that's less full if you're wanting to switch topics. So the room assignments are at the back of the room. Don't get up now, but in a moment you can go to the back of the room and you can find your name. It's organized per topic first and then in alphabetical order. We also have the topic assignments out on the tables at the registration tables. And the thing I want you to remember is that really it's actually not about the topic, because really this is all interconnected. Everything that we're talking about relates to each other. What relates to the forests relates to our health, relates to fish and wildlife, relates to agriculture, relates to our infrastructure. These are not truly separate topics. It was just an easy way for us to group you. And the facilitators, give them a huge round of applause. I just realized they all walked out to go get ready for you, but I want to acknowledge them. They are experts. Expert facilitators. Many of them have years and years, some up to 25 years of facilitation experience. These are professionals that have volunteered their time, not only to do the trainings, review the materials, give me feedback on the materials, and then they're spending these 2 days preparing and then hosting these conversations. So remember, these are professionals. They do this professionally. They're amazing. I am in awe of who they are and what they're up to. Also, our exhibitors, if you want inspiration for some solutions to see in the world, that's what our exhibitors are here for. They're offering some amazing solutions and we're really excited to have them. So take a moment at the end of today, visit the exhibitors. At the end of today, we will also have the reception at the Stuckel Sky Center. And we invite everyone to participate, everyone to come and join us. It is an informal networking reception. It's $39. I believe we have about 100 folks registered, so about half the attendees here have registered for the reception. You can buy tickets at the door. We look forward to seeing you. It'll be lots of fun. The bar closes at 7. So last call is at 7. The bar closes, I don't know when, but last call is at 7. So you can hang out, mingle. Make sure you drive safely and you're sober before you leave. And what to expect today. So when you go into the facilitated brainstorming session, what you'll be going through are 2 different exercises today. And the first exercise is for you to identify some themes. First is story sharing. You're going to listen to each other, take notes. You'll have Post-its. And on the Post-its, you'll take notes on those aha moments, something that inspired you, something that made you go, I never thought about that. I was actually taking notes earlier today on some of the quotes, and they were really great, really inspirational. So take notes using the Post-its, and then you'll be grouping the Post-its in exercise 1. Exercise 2 is about sorting them and then coming up with how might we, and it's opening up the possibility space. We will end with the how might we statements. So you'll arrive at a series of how might we ... How might we, I don't know how it will be because your group will come up with its own, but you'll find yourself in a place of opportunity and possibility, because that's what we see as available to us, is a possibility of economic opportunity and growth for Idaho. And then tomorrow we'll come back. I'll do a brief, just kind of, hello, welcome back. And we'll go into the second brainstorming at the end of the sessions. In the morning, however, we will have a recap of today. By Tony Hardesty from the Nature Conservancy. So one of the things I ask everyone to do is to take really good notes. And we also have a note taker form, and there's instructions on the table. So please use the notes. Make sure that there's a note taker at every table. If there is not one, maybe one of you could volunteer to be a note taker and help upload information. Also a reminder, please tweet any interesting quotes, insights, thoughts. I've noticed some of you already have. Thank you. It looks great. It's really fantastic to watch the social media conversation. Next, we're going to take a 10-minute break, and then you'll head to your breakout sessions. Are there any questions at this point? Nope? Okay. Enjoy, and most importantly, have fun. So you'll go to the back of the room. The assignments are at the back of the room. Take your time. Find out which room you are in and which table you're at.